Hi, my name is Dr. Derek Espino, and I'm the owner of Riverview Dental Arts. I'd like to speak today for a few minutes about dental insurances because I find that almost no patients understand their dental insurance, what they're really getting out of it. And I think it's unbelievably important because it's important for you to know how to get the most out of your insurance so that you can afford the care that you're getting, and also make sure that the existing office that you're going to is giving you the best deal when it comes to what you can get out of your insurance. So this is a very, very important topic, and it's gonna take me a few minutes, but it's worthwhile, I think, listening to the entire thing to see what I have to say so you really understand this. So there's basically two different types of insurances. There's a PPO dental insurance, and then there's an HMO or a DMO or a discount plan insurance. So first we're gonna talk about PPO dental insurances. I am an in-network provider for pretty much every PPO insurance. There's only a couple that I'm not an in-network provider for, and they're small, it doesn't matter, but most of them I'm an in-network provider. And there's a very big difference between being an in-network provider and somebody saying that they take your dental insurance. So let's look at PPO dental insurances really quick and the breakdown. So with the PPO dental insurance, you're gonna have a certain yearly maximum that the insurance is going to give you. Cash towards your dental treatment, okay? It's what they're actually going to pay towards your dental treatment. That maximum yearly is different for every insurance. Usually it's between $1,000 to $2,500, and sometimes a little bit more if you have a better insurance, but most are paying $1,000 to $2,500 towards your treatment. Now what they pay towards your treatment is a certain percentage of their insurance-based rate, and this is very important, a certain percentage of their insurance-based rate. Okay, so for instance, usually 80% coverage on a filling. So let's say an insurance-based rate for a filling is $100. They're gonna pay 80%. They would pay 80, you pay 20. So the breakdown for all this for every procedure is all similar. Usually it's about 80% coverage on fillings, 80% coverage on periodontal treatments like deep cleanings or things like that, 50% to 80% coverage on crowns. So if you look at your insurance, there's going to be a certain breakdown of percentages what they'll pay towards. Now this is the important thing. They are going to pay a percentage towards your insurance-based rate. And this is where it comes in the difference between being an in-network provider and somebody saying, oh, we take your insurance and we will bill to your insurance. As an in-network provider, I am going to do the procedure at the insurance-based rate. So going to that filling as being $100, I'm going to charge out $100. I will get 80% or $80 from the insurance. I will get $20 or 20% from you. If somebody says they take your insurance, they don't have to do the procedure, and they're not going to do the procedure at the insurance-based rate at $100. It may be $300, and a lot of times it's either double or triple what it normally is with the insurance-based rate. So going back to that, if the procedure is now $300 and they say they're going to take your insurance, they're going to bill the insurance 80% of the insurance-based rate, $80. But you're going to cover the difference. So now you're going to pay $220 instead of $20 for the filling. Now that's just a filling. What about crowns? For instance, the average crown with the dental insurance, PPO, is around $800. That's the insurance-based rate. Usually the coverage for a crown is 50%, okay? Which means the insurance is going to pay $400. You, as a patient, will pay $400 for the difference for that crown. That's as an in-network provider with a dentist like myself in my office. If you go to a practice that says, oh, we take your insurance, they can make that fee whatever they want. Usually it's $1,200, $1,300 or $1,400, not $800. So they're going to bill to your insurance $400, 50% of the insurance-based rate, but you are going to pay the difference. So if it's even $1,200, now you're going to pay $800 towards your crown instead of $400 towards the crown, which is double. And that goes across the board for any procedure that we're talking about, whether it's fillings, crowns, deep cleanings, dentures, partials, you name it, implants, everything across the board when it comes down to it. But most patients, they don't ask that question. They will call and they will ask, you take my insurance. You're asking them, really, are you giving me the best deal? They're not going to give you all the information. They're going to say, oh, of course we'll take it, but they're not telling you that they're an in-network provider. That is an important question to ask, and it's something that I think is worthwhile making sure that you look into this, because if you ever have had procedures treatment plans done where you're questioning, well, gosh, man, I'm spending thousands and thousands of dollars. What is my insurance actually paying for or covering? You might be getting some help, but you may be paying a lot more than you need to. I've had a lot of frustration over the years from having patients that have come in that are new patients, and they would hand me treatment plans or had questions about this. And I found honestly that they were misled, didn't have not a lot of understanding, and were really, really surprised about what we were able to do for them, that it was affordable and the quality of care that we can give at the prices we can, being an in-network provider. Thank you very much. I'm Dr. Derek Espino from Riverview Dental Arts. Have a great day.